Well, this year's status of the Social Security and Medicare programs report indicates that Part B premiums are expected to increase by more than 50%. But before you get too upset, know that it is projected that 70% of the beneficiaries will not have any increase at all. Here to explain this change and what it means is certified financial planner and founding partner of Egan, Berger & Weiner, LLC, Michael Egan. So hi.
Hey, Julie,
hello.
how are you?
Thanks for making it in today.
Absolutely. I got a little hungry listening to your previous segment.
Really? I know.
Yeah.
This show will do that to you. So first of all, tell me, what is Medicare Part B? How is the program funded? Like, explain all of this. Break it down.
Okay, so you got two parts to Medicare, Part A, Part B. Part A is the hospital bill part.
Okay.
And that's funded while you're working. So in retirement, typically you're not paying for it because you already paid for it while you're working. And
supposedly, yeah. Okay.
And the trustee report came out and said that that's in pretty good shape right now. It's funded through 2030 with the trust fund and everything else.
Okay.
But Part B is paid for, which pays for the doctor bills. That's paid for by you and by the government. So it's like a cost-sharing thing. And if expenses for Part B go up, then the people who benefit from it, who are actually using it, their premiums would go up.
How come it doesn't work the other way around? How come the government's end doesn't go up?
Well, you know how it is. I mean, we got a pretty big deficit right now. But, so the projection is right now that if there's a Social Security increase for next year, that everybody would pay a little more for Part B, about 14–15%. But Social Security increases are a function of inflation. And the projection for inflation right now is it potentially could be zero because we saw energy prices go down and everything else.
Right.
So if the projection comes out to be zero, there's a provision called hold harmless.
Okay.
Which basically says if you don't get an increase in your Social Security check, we will not increase your Medicare Part B premium if you fall in this group.
Okay. Wow. So how are you going to know if you fall into this group? You'll know, like, if your Social Security check increases?
Well, yeah. So let's try and play a little bit of advanced planning.
Okay.
So if you are currently receiving Medicare Part B benefits and you're paying for the premium for Part B out of your Social Security check, and you make less than $85,000 a year as a single person, or less than $170,000 a year as a married couple filing jointly, then you're in that whole harmless group. Okay. So if the Social Security check goes up, doesn't go up, then your Medicare premium won't go up either.
So this will definitely benefit our elder folks.
Yeah.
Older folks and, like my parents who retired.
Absolutely. Yeah, I mean, I guess on the flip side, you're saying, well, I'm not getting a bigger Social Security check, but I'm also not paying more for Part B.
Right.
But what that means, though, is there's still a cost-sharing mechanism. Okay. So the other 30% who aren't in that group now have to bear the brunt of the full increase themselves. Okay. So instead of having a 14% increase for everybody across the board, that group is now having to pay 52% more unless Congress does something before before the implementation comes out.
You got to keep all of this in track. That's why we need you. All right, so to be or not to be, that's the question. And what does that mean exactly for us?
Okay, so a lot of the clients we work with in this area work for the federal government. So in retirement, they have the federal government health plan. And for them, Medicare is an option to add on to that plan, but not really a requirement.
Okay.
And many people, because Medicare Part B was so affordable, it was only like $105 a month for the majority of people, chose to add it on, and in many years, if you had heavier medical expenses, it paid to have the Part B.
Yeah, it kind of balanced out, right?
But if you're in one of those higher income groups where the Medicare Part B premium could be 4 times that number, does it really make sense anymore if you're a federal employee to have Part B, pay a lot more for it, get put in that whole harmless group, and potentially have an increase of $2,000 to $4,000?
Right. So, Michael, this is for people like on retirement? It's not like for somebody like me right now.
No. So people age 65 and older are eligible for Medicare. And it becomes the primary health plan for most people in the United States, except for the federal employees who have their own health plan in retirement. All right. Good to know. All right. So when will the actual rate increases for 2016 be announced? Sometime this month.
Oh my gosh.
So keep an ear out for it. And I think that Congress is probably, since it's an election year, the good thing is I think they're probably going to do something not to have that 50% increase for that 30% of the population. Right. But that's the way the math works right now. So let's cross our fingers and hope for the best.
Exactly. And we got to keep in touch with you because you just break all of this down. You make it really easy to understand. But there's a lot, and it gets complicated when you're sitting at home and you're trying to read it by yourself. So that's why we need to come see you. All right, thanks, Michael, for joining us today. And for more information about Mike's financial knowledge, you can visit ebwfinancialnews.com. And stay with us. More details about the firm at ebwllc.com. More of Let's Talk Live coming up after the break.